In November 2023, the Kingdom of Eswatini conducted the first of its kind full-scale simulation exercise focusing on cholera outbreak. This exercise was carried out at Mvabangeni in the northern Hoho region that borders South Africa. The World Health Organization and other partners sent a team of experts into the country to help the Ministry of Health to carry out this exercise.
The simulation exercise, which we've just conducted here in Eswatini, is one of the key components of the international health regulations, monitoring and evaluation framework. The simulation exercise basically tests the functionality of the country's preparedness and response plan. During this simulation, which was a full-scale simulation, WHO supported the design. We also supported the actual conduct. We brought in a number of technical experts to support the different pillars in the response plan.
We are implementing a simulation exercise as part of our preparedness for health emergencies. And it is going very well. We are happy with it because it has come to test our systems. We develop plans to be ready to respond to specific emergencies in health. And in this particular case, we are using the cholera outbreak to do the simulation. And it is going well to test if our systems are working as we had worked them out on the desk, and if we will be able to respond should we identify a case of cholera.
When you simulate an exercise like this, you need to basically involve those who are most likely to be directly impacted. In this particular instance, communities. The idea was basically to look at how we're going to communicate, how we're able to coordinate, how we're able to have our surveillance and reporting strategies as well. And I think at the end of the day, what we're seeing is the community involvement is going to be critical because when this does happen, just like COVID-19 did, the communities are prepared, citizens are prepared.
But we'd like to understand clearly if this is really taking care the interest of children.
Under WASH and under education, we have specific interventions that talks to creating the awareness, that talks to capacity building of teachers, so that this can be transferred to the learners in school.
What we have seen in the past couple of days is that we've been able to test our level of preparedness to respond to pandemic, in particular health-related issues like cholera. So on this simulation exercise, we realized that the country has some level of readiness to respond to such hazards. And we also have been in a position to identify areas of improvement as a country in order to strengthen our health systems in the country. So we're saying simulation and testing exercises are very important because they enhance the level of preparedness for the country in two levels. One, for the first line responders or the stakeholders that we use in responding to emergencies. So we also were in a position to see if they are ready to respond to those emergencies.
Disease is no boundaries. And that has been seen from what we have been doing over the past year. In 2023 alone, we have been chasing after cholera, particularly in Southern Africa.
From the simulation exercise, we will be able to identify where there are gaps, where there are areas that need to be strengthened. And we're grateful to the support from WHO and Africa CDC, experts that are here that we're working with them, and they will compile what has been observed to be weaker elements and stronger elements to build on. So going forward, we are going to be using this report to strengthen our public health emergency system, to strengthen also our sensitivity to be able to detect and respond to health outbreaks. So this is very, very important. And it is part of an obligation of a country to be prepared for emergencies as you know, that we need to be working with our neighboring countries, then we'll be able to work together and we'll be able to contain and prevent further spread of these health outbreaks and all these public health emergencies.
The people at the control room, they have a prepared list of stated injuries, which from time to time is time-gated. We send out to those at the sites to see how they're able to respond to these injuries. And of course, we have been testing different capacities within the country to know exactly how prepared they are for emergency. And of course, everybody is waiting for the outputs of this exercise. And I believe that we are going to be able to determine how the country is prepared in case of large-scale cholera outbreak.
And from that report, we'll be able to identify what are the gaps in our systems, what do we need to strengthen, what are the strong points so that we build on them. How do we, for instance, strengthen community action? We're interacting with the people here. We have seen that there are points that we need to strengthen under community. So going forward, the report will help us strengthen our readiness and preparedness should any outbreak come into Eswatini. That's what we will use.
We are constantly trying to ensure that the government is ready for when things like this happen. And the key part of that as well is to plan ahead. Preparation is not only about planning and responding on time, it's as well about saving lives and saving costs. And with regards to saving costs, we're already helping the government in procuring stockpiles. And those stockpiles are in readiness for any eventuality in the future. So we're willing and continue and ready to work side by side with the government as it continues to strengthen its capacity to be able to deal with issues that relate to emergency preparedness or pandemic preparedness, and more importantly, its response in the event that it does occur.
Going forward, having looked at the gaps, WHO will support the development of the improvement plan, and also will try and strengthen some of the areas that have been identified, the weak areas that we've identified, such as case management pillar and also infection prevention and control pillar.
nato siyadibonga futhi siyacela ukuthi niqhubeke niphathe kahle toqhubeka libuye evela lapha ifake imali etawusita abantu lebahluphekile emaswati more especially emaswati lahluphekile nonke sibongelene kuhulumende weNgonyama ukuthi asikhumbule singabangela siyabonga.